Well, the cost of cancer medicine in South Africa is proving prohibitive to patients getting the care they need. Health activists have cited one drug specifically for cancer attacking plasma cells that costs 828,000 rand per year for one patient here in South Africa, while drugs with the very same properties cost around 30,000 rand for a patient in India. The high cost of drugs for cancer and TB have led to people dying. Last week, the Minister of Health, Aaron Motsoaledi, opened the second Global Fair Pricing Forum in Johannesburg. The forum was established by the World Health Organization in a bid to tackle high medicine prices across the globe. Well, to discuss this issue further, I'm joined by a civil society activist, Salome Meyer. She's from the Cancer Alliance from our Cape Town studios. Thanks very much for joining us, Miss Meyer. How can it be that in India, a cancer patient with exactly the same sickness, diagnosis, etc., will only have to spend 30,000 rand on their treatment per year, and yet in South Africa that's closer to R1 million?
In India, there are many generics available for cancer drugs. However, in South Africa, we have got a patent law that actually restricts access to medicines, and that's crucial medicines. So the impact literally is if the originator company comes and register that originator product in South Africa with SAPRA, that medicine is then the only medicine that can be supplied to our South African community, and therefore generic product that would be cheaper would not be allowed to be accessed by patients.
So given what you've just explained to us, and given the fact that government knows this, why don't they change the legislation so that we can be able to use generics and people can afford less costly medicine?
The Fix the Patent Law coalition that exists, and that is a group that was being formed like 10 years ago between Treatment Action Campaign, Section 27, Medicine Sans Frontier, Cancer Alliance, and many other civil society organizations have been asking for the change of South Africa's patent law. We have achieved some winnings in the sense that last year the patent policy changed, and that paves the way now for a change in the law, and we are very hopeful that after the elections we can tackle this issue head on.
And of course, we have a very real conundrum in South Africa in that the vast majority of South Africans do depend on public health services. And hence, this issue is even more urgent because not everybody can go to private healthcare.
That is correct. When a medicine's price, as the one that you have just quoted, is so exorbitantly expensive, it really means that government cannot buy or pay for such a medicine. And this is where the argument comes in. So when I had HIV, it was affordable to actually treat me. However, now that I may present with a cancer, it is now we have to hear that patients say, or that it is being called, it's not cost effective, because that actual cost of saving that person's life is really then the question that government has to answer. And we're asking the question, is that fair?
Indeed, is it fair? And certainly it isn't fair. But in terms of the number of needless deaths that you estimate have happened in South Africa as a result of this situation of unaffordable medicine, what's the estimation? How many people may have needlessly died because of this situation?
That is not the easiest of question to answer, because we must understand that cancer is a very complex disease to manage and to treat. So chemotherapy is not the only way of treating patients. There is also radiation therapy, and we know currently that there is a crisis in cancer in the country at the moment because cancer treatment is so unaffordable. And that's all spectrums of treatment. And I think the KwaZulu-Natal example is actually just one example. We in civil society have been saying that more people have died in KwaZulu-Natal due to a lack of access to cancer treatment than actually died in Life Esidimeni. The reality, though, is we don't know what those figures are, because cancer patients are sent home to wait until we recall you for treatment And by the time they are recalled, it may be too late.
Yeah. And Salome, just to give us a global perspective, it doesn't seem to be the problem of low and middle income countries alone, does it? It does seem that even in rich countries, people are struggling to get access to the drugs that they need.
This has suddenly, over the last 5 years, has become a global problem. And in fact, I actually want to make it shorter than 5 years. I want to say in the last 2 years. Even in America, President Trump, that we know kind of like is more in favor of some of the pharmaceutical companies, are actually calling also for affordable medicines. And it's going to be actually very interesting to see how the US elections pans out in terms of the affordability of cancer medicines. We also know that a rich country, and I say a rich country such as Switzerland, is calling for the same thing. So globally, the civil society organizations are calling for fair pricing, and we are calling for the delinkage of research and development cost, because that is what pharmaceutical companies are hiding behind. They're saying that the research and development cost is what is making cancer drugs so expensive. However, we heard a very alarming fact as well during last week's Fair Pricing Forum, when we heard that many of the pharmaceutical companies are hiding their profits in countries where there are tax rebates. Now that in itself is something that we call immoral and actually should be exposed.
Ms. Meyer, thank you very much for educating us on this subject. I was speaking there to Salome Meyer. She's from the Cancer Alliance. Well, more on the discussion on the pricing of cancer medicines after a short break. Do stay with us.